We are done.
The Patient Protection and Affordable Care Act has undeniably been an impactful piece of legislation in the history of America, even now a mere 6 years after its enactment. Since 2010, the highly controversial statute known colloquially as Obamacare has affected millions of Americans with regards to how they access, consume, and pay for health care.
The Affordable Care Act was passed in 2010, and the underlying intent of the Affordable Care Act is to expand affordability and expand availability for all Americans.
When Obama was first running 8 years ago, that was one of his primary ticket planks or platform items. And the point that he was trying to get across, so there are almost 50 million Americans who didn't have access to quality health care. Every American has access to health care. All you have to do is wander into a hospital and they have to treat you. Additional almost 20 million more Americans now are covered who previously weren't covered.
As for the newly insured population of Americans, potential solutions for fixing the ACA's problems are often raised in direct support of repeal, which does little but cause anxiety for those who stand to lose their newly gotten coverage.
Pre-existing conditions has been removed, so no longer can a carrier deny someone coverage by having a pre-existing condition. Also, dependents are now allowed up to age 26 to be on their parents' plan, whereas before the student, they must be a student to be continued on their parents' plan.
But what of those people who don't qualify for subsidies provided by the ACA, yet still see sometimes unaffordable hikes in premium costs?
What we offer to our hourly employees prior to that was more of what's considered a limited medical or a catastrophic type plan, which really only paid an accident or sickness. So under the ACA, because we now have to provide essential health benefit type coverage, that significantly changed what we offered to all employees. And those plans are much more costly.
The millennials 21 to 26 now are being covered by your parents' insurance plans. That's massive. Because you guys are leaving college with this incredible debt hanging over your head.
The specific changes to healthcare that are impacting young adults today only represent a minuscule portion of the verbiage contained in the ACA, which goes to show just how powerful the latent effects of legislation can be. The good or bad descriptions to impacts of the ACA that are felt by Americans becomes increasingly more subjective with legislation that grows in complexity. To the beneficiary and the exploiter alike, Obamacare is a welcome respite from previous systems. Becomes a despised burden, as its provisions in some cases make healthcare considerably less affordable than before.
We have to ask the question, what are the major employers, what are the major income sources that are up here in the high country? Okay? But people always joke, well, it's Christmas trees. Okay, well that's pretty. But it is farming and it is the university.
Right.
Okay? So whatever changes may take place in Raleigh that affect the university, okay, is going to have a profound effect on the area immediately outside of App State.
Young adults faced with the decision to purchase healthcare on their own for the first time may see little incentive in paying for insurance that they will likely not use. Without incentive, these groups often opt not to purchase the healthcare, which leaves the system with disproportionate ratios of patients that have higher healthcare costs associated with them. This strain on the insurance industry results in universally higher premium costs, while leaving consumers confused and frustrated that their affordable plans are increasingly more expensive.
I heard all that you keep your healthcare provider and everything else, and that was all nice, but it's if you could afford it, because the premiums went up for me. I'm guessing that was so that I could accommodate those that couldn't afford it, to make it more affordable for them. So I haven't had health insurance since then. I mean, I can see the positives to it, where some people get to stay on their parents' health insurance till they're 26, but then there's those of us that don't have that option.
I think there are very key components of ACA that will never go away, such as the pre-existing conditions being taken away. I think those type things, leaving the dependents up to age 26. I think those will stay intact. I think what we are most likely to see is a modification or the plan refined.
Well, I mean, I don't think it's right and it's not very American to force people to buy something.
They're all inextricably linked together. You can't just talk about Medicare and Medicaid without talking about Social Security and the aging population of the country.
Health insurance reform becomes law in the United States of America.
As a statute that impacts nearly every single American, understanding the provisions that the ACA includes is paramount for debating on how to fix its inefficiencies. With shared knowledge, the proper path forward for the largest portion of the population becomes much easier to discuss.